Hi, I'm Dr. Matt Sheehan, chiropractor at Medford Family Chiropractic Center in Medford, Oregon, and I'm joined today by my friend Angie Orr, who is a licensed massage therapist here in the Valley. And I'm here to show a Pilates exercise. As far as I'm concerned, it's rather advanced, but I'm not real hugely skilled at these. But this is a next step exercise, strength exercise for the core, for both the oblique muscles, the quadratus lumborum muscle in the back, which in this case are side bending muscles, and also what we call the gluteus medius, which raises the legs sideways. So we're going to work all three of those muscles at the same time. And this exercise is not for the faint of heart. So you want to make sure that you go through some of the other easier exercises, the beginning exercises, to make those muscles more toned before you jump in and do this one. This is for people who've been doing it a while and want a little more oomph. Okay? So, Angie's going to demonstrate this one, and she's going to be lying on her side. And what you want to do is you want to have your one leg on top of the other, and you want to be vertical here, so one hip is vertical right on top of the other. So in other words, you don't want to allow yourself to do this or go the other way. You want to be up here. You can lean on that top hand for stability, and your downside arm is going to be right over your head, and you can rest your head on that arm. Okay, and we want your legs just a couple inches in front of your hips. All right, and what we're going to start out doing here is we're going to raise this leg up as high as you can, right in there, and then just raise it up, hold it for a couple seconds, bring it down. Do that about 5 times just to warm it up. That's right, and up, and so we'll count. And the count for this is slow. It's not a fast count. It's 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. Then down. So do about 5 of those. And then what you want to do, you're going to come on up, and you're going to hold the leg up as high as you can. And then you're going to bring the bottom leg up to meet this one, or just as far up as it can go. So you're going to bring it up, hold it for a couple seconds, then bring them both down. And then you're going to repeat until you feel like you're going to die. No, I'm kidding. But you're only doing it to the point of the start of fatigue, which may be literally just stage 1, where you were just bringing that first leg up. You may be going, oh my goodness, no, that's enough. That's fine. Work up to it. All right, so you're going to quit when you hit mild to moderate fatigue. Then you flip over and do the other side. So we got one leg coming up and down 5 times, like that, and then we got one leg coming up, and we got the other leg joining it, hold for a couple seconds, then bring them both down. And then the third one, the real killer, is you're going to bring them both up. So, you ready, Ange? There you go. Can you hold that for about 20 minutes while I talk?
20 minutes!
Okay, so yeah, up and down on that. Hold for a couple seconds, maybe 5 seconds, and then bring it down slow. And just repeat till you get moderate fatigue, which again will probably not take very long. So that's a great exercise for 3 muscles: the gluteus medius, which is responsible for raising the leg, and then the oblique muscles here, which are responsible for side bending you. So they're really taking these hips and pulling them up this way and stabilizing this whole area. And then the third muscle is this quadratus lumborum in the back, which is another side bending muscle, and they're all 3 stabilizers. They're core muscles which stabilize both the low back and the pelvis. Best way to do these, since they're strength exercises, I always tell my patients twice a week. You don't want to do it every day. You'll get weaker, not stronger. You need a couple days in between for your muscles to repair and get stronger. So a couple times a week, do I would say 1 set on each side of each of those. And again, don't push too hard. Don't think you have to do it. You don't want to push too hard, or you'll end up restraining the muscles you're trying to heal. There we go. Thanks.